The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm here with the fabulous Dr. Doreen Granpeesheh.
Good morning.
Good morning. How are you?
I'm good. How are you?
I am so thrilled to be here with you
It's been
in the
ages.
studio.
Yeah.
When I just started to get a little emotional thinking about, when I think back over my life, I think this will be one of the highlights is getting to sit here with
we
you.
do this. Yeah, we haven't been here for a long time.
We really have. I think we've done one show in here this year.
This year, wow.
Yeah, and then we've done everything else remote so that I didn't infect you.
Well, there's just been so much going on.
Yeah,
I've
there's
been
a lot
traveling. You were sick for a while.
Yeah, but you
We're
look
back.
fabulous.
You do too.
I'm
I'm
thrilled
glad
to be
that
here
you're
with
healthy
you.
or getting
yes,
there.
I'm getting there. I feel like me again, which is, I had said to Jim a couple of weeks ago, someday in the next few weeks when I'm feeling better and I'm just taking it for granted, I want you to remind me.
Yeah.
And be like, hey, this is a good day.
Yeah.
You're upright and you can breathe. It really kind of takes you back to basics. But it helps that we're here and that this is part of our mission is to be here. You guys know if you're watching the Autism Network, our mission here is to provide information and inspiration. And boy, we never do it better than we do when you're here.
Well, thank you so much.
So.
I love to be here. I'm glad we could make it work today.
Yay! So thrilled. So for those of you who don't know, Dr. Granpeesheh is a true expert in the field of autism. She's been working in this field for more than 40 years. I know that seems unthinkable because she doesn't look like she's been on the planet for 40 years, but there we have it. I particularly love her because she has such a passion for everyone in this community, the people who are themselves on the spectrum, but also for the people supporting them, for the dignity of those individuals, for their individuality, for their right to live happy and productive lives that are meaningful to them.
Absolutely.
Which means something different for everybody.
Definitely.
It's not a one-size-fits-all, but you have committed your life to this over and over and over again, which is really amazing to have been able to see and watch. And I don't know who I was talking to recently, but I always use the phrase when I'm talking about you that the first time I met you, I went, okay, I would follow her into a burning building because I would know she was going in for a good reason.
Yeah.
And you have continued over the years that I've known you to prove that to be true.
Thank you, Shannon.
And you're one of the fairest people that I know, so I just adore you.
Thank you.
Now we wipe away the tears. Okay, so, but part of the reason that we're here is so that she can take this hour and share her beautiful mind with those of you watching at home. Whether you are the person on the spectrum or you're somebody who loves somebody on the spectrum, you may have questions. And so we always give the disclaimer that there is no expert who can give individual specific advice, but if you'll write in, tell us what your story is, what your question is, be as specific as possible. Also tell us where in the world you are. That's a particular fun for us, but it also keys us into knowing where your resources might be and what they might be. So already Park has written in and said, hello, always look forward to this live session. Thank you always, Park. We're so thrilled that you're here with us. That's an example. We're live right now on Facebook, YouTube, Twitter, and about a dozen other sites and our fabulous Chris Desmond is showing them to you on the screen. I always like to remind you guys, we do this live, and it's playing live on YouTube and Twitter and Facebook, but then it's archived sound and video on YouTube. And there are two YouTube channels. There's an Autism Live YouTube channel, and there is an Ask Dr. Doreen YouTube channel. So you can check out our archives from the last 14 years. My goodness, 14 years. It's a little crazy.
Much? Oh my
yes,
gosh.
it's a little crazy.
It's a lot.
So it's a lot, but it's great. It's there for you. It's free. But we know that most of you are consuming this content as part of a podcast. So we are a free download wherever you get your podcast. You can find it. I really want to encourage you when you go to look for this particular show, find it at Ask Dr. Doreen. that it is a free download. I want to tell you that if you download it for free, there will be ads. I hope you embrace that. That's what makes it free for you. If you're somebody who's like, no, I really would rather prefer to get it without the ads, you can do that very simply by going to glow.fm/autismlive. And when you go there, it'll be $5 a month, and then you will get everything that we do at Autism Network. It will automatically show up in your inbox, and it will be ad-free. So if you're on the treadmill, you're in the car, and you prefer to have it without the ads, please do that. Know that we're not making a whole lot of money off of you doing that, but that defrays the cost for us enough to make it possible. There is no such thing as a free download, but we have worked very hard for the last 14 years to make it free for you, if that is what you prefer and need. I feel I've left something out, but I'll think of it when we get to it.
We're good.
I want everybody to know that we have a starting topic today, and that is a term that you coined, which is medically enhanced
ABA.
ABA.
Yeah.
Maybe take a second and talk about what that is and why that's
Yeah.
important to you, and then we're going to get into some questions.
Sure. So what it is basically combining medical interventions with behavioral interventions. And the reason it's important to me is that, first of all, it's disappointing for me to see that there's such a division in the world of autism treatment, because it's just not fair to our patients. And it's almost, I don't know how it came about. I think it maybe came about because for so many years we still really don't know enough about autism and what causes it, how to treat it, all that sort of stuff. And we still don't really, you cannot say definitively that one single thing causes autism. And it is a big spectrum. I don't think we've made enough progress in identifying all the different variables that affect autism, that cause autism, etc. We're getting there, but it's a very slow process. That said, that has led to, and then, as we're trying to find out, what are the causes? What are the correct interventions? A lot of people started to just look at, these are the symptoms. Let's not worry about the causes. These are the symptoms. Let's treat the symptoms. And that is both from a medical and behavioral perspective, really what we do today, right? There's really nothing that is working on the causes, except for maybe dietary interventions. But mainly what we're doing is you have certain symptoms that make it very difficult for you to live and thrive in society and learn.
Yeah.
And we try to help you by, modifying those various symptoms. Now, the studies that were done early in the 90s, before the 90s, 80s, and 90s, and were very, very successful in helping individuals with autism do well in society, were all behavioral. They all kind of showed that, individuals who have autism can learn very well using behavioral techniques. Okay, great. So that became something that was then, and don't get me wrong, throughout the 90s, I would say we changed a lot of kids' lives, right? A lot of families' lives by doing these interventions. So it was very powerful. And so a lot of people came and said, listen, this should be paid for by my health insurance, because this is something that is saving my kid's life. It's a huge thing. It should be paid for. So we then went down the path of getting it all kind of authorized and lobbied and, et cetera, et cetera. And over the course of a few years, we're able to get health insurance to recognize the field of ABA, behavioral interventions for autism, and to fund it. This is a very, very significant thing, because the other areas of psychology were for a long time, before mental health parity, not even funded the same as ABA. ABA had better funding for autism when it came to just autism. So anyway, it was like, recognize that behavioral interventions are effective for autism. The same time, obviously, there are some individuals who have such severe symptoms that they needed help more rapidly, and the way to help them was medical intervention, right? And so we started to also, on the medical area, started to do a lot of medical interventions. Unfortunately, instead of those two professions kind of coming together and saying, hey, let's work together to make things better, they were divided. And here are the behaviorists saying, I know what I'm doing, and here are the medical doctors saying, no, you have to treat it with medication. And so this became a very divided field, which obviously is not good for anyone, because many individuals benefit from both medical and behavioral. So now I kind of want to talk a little bit about the history of my history in terms of discovering that, I will say, for myself, right? Because here are these two parallel fields that are happening. And my experience started, I think, with early on in the 90s. I would interview every parent myself, trying to find out more about their children. And I discovered that almost every family that I spoke to, one of the early things that was going on with their child was, my child had very severe ear infections very early on in life, and therefore we had to treat him or her with one after another antibiotics. And so I was like, whoa, this is interesting. Seems to me like a significant overuse of antibiotics, which, by the way, across the States, we all agree was happening back in the 90s. And so then I started studying, what does that do when you overuse antibiotics in the body of a very young child? And of course, the answer is it destroys all healthy bacteria. It destroys gut flora. Now you have to realize, you guys, this is the 1990s, so it's before every other commercial on TV was a probiotic. Nobody had even heard about probiotics back then. So this is, so I'm coming to realize, oh my God, there's got to be some sort of correlation or something. It's very strange. So I started to collect more and more history from our kids, and then came to realize, okay, so there is a lot of these kids are having some sort of illness that is treated either with antibiotics at an early age. That's one group. Then another group, this whole started with one little girl I will never forget, and she started to develop fungus on her nails. That doesn't really happen with a 3-year-old or a 4-year-old. And so we started treating the fungus with antifungal medications, and her behavior changed significantly. So that was the second thing where you were like, oh my God, like how is an antifungal medication interacting with behavior like this? So there was some other thing going on. And so, long story short, I kept observing these interactions where you would treat a child with a medical treatment, and all of a sudden you would see them kind of waking up and really learning faster. Now, at the same time, there was a group of parents who were amazing and had come to form this group. I kind of remember that it was called the Andy group. I don't remember what that stands for, but this was the group of parents who had realized that a lot of kids were not properly digesting casein and gluten. And that was very, very interesting and important, because they began this whole movement of, if you can actually eliminate those things from the child's diet, they will wake up, do better, learn better, etc. And let me tell you, they had a huge impact. And the whole field of autism, the fact that a lot of kids with autism do have gluten intolerance, casein intolerance, that is why today you go to restaurants and you can say, I'm gluten-free, right?
Right.
That was not something you could do in the 90s. Even in the 2000s, that has gradually occurred. So I would say, as I observed all of these things, I came to realize that it is extremely important to treat both sides, the medical side, because without doing that, the child is not stable, right? if you kept a child who has gluten intolerance on gluten, if you did not treat a child's fungal issues, if you didn't do this medical stuff, the child, and then, I mean, I could keep going forever, but what happens is obviously the child's struggling, the child's suffering, they're not stable, they're not feeling good. So how are we now expected to teach them with intensive tutoring, right, and teaching them using ABA? How do we expect that child who doesn't sleep, that child who has severe gastrointestinal issues, how do we expect that child to sit and do ABA therapies and learn? And when we started to treat those medical things, taking data, we noticed, oh my gosh, the kids are learning a lot faster. So that is medically enhanced ABA. You use medical interventions to increase the rate of learning. And that honestly happens, it's not just autism. If you think about it, Shannon, anyone who doesn't sleep is not going to be able to do anything else, right? They're going to be out of it all day. So really, it's a very simple concept, but I think that it's important for autism.
It's a simple concept that you've been talking about for a long time. I mean, you were talking and doing talks that were about the whole child.
Forever.
And you took so much heat from the ABA community.
I did, yes.
So much heat. But meanwhile, back at the ranch, can I just say, as a parent, we were sitting there going, but yes, my child has other things that are going on. And there was a period of time when my son started ABA, there were ABA companies that would not take you if you were doing a gluten-free, casein-free diet, because they're like, we want a pure example of what the progress that they're making from ABA, which I remember going, that's crap. That's not taking into consideration my child and wanting what's best for my child. That's you wanting to pad your data, and I'm not interested in that. You were the person in the forefront, and you took heat, literal heat from people. And, you know, that's all turned around now. I think people are beginning to see. It's not, we're still not there, right? But I think more and more people are starting to recognize this is an individual who has a right to medical treatment for things that are going on. That seems like such a duh to the parents.
Who needs medical treatment? I'll go a step further. Because, you know, autism is this thing that's so pervasive that it overshadows other illnesses. Like I've said to you many times this example of, like, you know, you don't realize it when you're a parent and you're growing up and your child is growing up and you are dealing with stuff every single day. But I, as a practitioner who sits and like meets with you for a couple of hours for the first time and asks you a lot of questions, I notice this overshadowing of autism. And the example is always the first time I remember this parent where I asked them stuff for 2 hours, at the end of which I said, is there anything else, you know? And she said, well, you know, he does have diarrhea 10 times a day. And I was like, oh my God, why didn't you tell me that? And she literally said, my pediatrician said, that is the autism.
Exactly.
And it has absolutely nothing to do with autism, right? There's a correlation. There's a higher number of kids with autism who also have GI, but it's not a causative factor. So you have to take care of the GI issues, right? Imagine how much that child is struggling.
Well, it's funny that you bring this up because that's our first question. My son has constant and chronic diarrhea.
There you go.
His poor little bottom is always red. We are doing ABA, but I feel like our progress is slow. How do I help him? But of course, why wouldn't it be slow?
I mean, it's just, there is no way. You have to treat the GI issues. That is the most important thing for that parent. You have to go down that path completely. And I, as a behaviorist, I will even go as far as saying, do the medical stuff first. Like, it is so important to figure that out. And it's not easy to figure out. And by the way, you have to understand, you guys, that we're talking about inflammation as a whole, right? Everybody struggles with inflammation, but some of our kids have such severe gastrointestinal inflammation. And when you don't treat it, you have to understand that the majority of the immune system is also in the GI tract. And that is affecting the immune system as well. So you must treat this child's GI issues. No child should be living with severe diarrhea. And that is more important than anything else. And yeah, when the child feels better, they will come back and they'll learn better, right?
Yeah.
Imagine it. It's funny, we don't think about it from our own perspective. You go to a restaurant or something, you have food poisoning. Are you going to go to work the next day? Are you going to be going to tutoring for 10 hours? You know what I mean?
Right.
No, you lay
And if
in
you
bed.
tried to, how productive would you be?
Would you be? How do you feel? And that is how our kids feel.
Right.
So it's very, very important.
Well, Kylie has written in and said, "Hi, Shannon. Hi, Dr. Doreen. My friend and I always talk about our daughters on the spectrum
Yeah.
who both have GI issues.
Yep.
One thing we struggle with is that our daughters can't tell us how they are.
Yeah.
And that's, I'm sending you a hug because that's part of the issue, right?
Yeah, it really is. It's very, very difficult. And I had a parent who, those, when you go to the ER, they have a set of pictures that are on the wall that are like 6 pictures of starting with a very smiley face to a very
Yes,
upset
to rate
face.
your-
Yeah, and they ask you how severe is your pain, and you have to
Yeah.
kind of pick one of those.
Yeah.
So I had a parent who used to work in an ER, I think, and actually had used that picture to get their child just on different days to point to how they felt.
Yeah.
And that is a really brilliant idea if you
Yeah.
think about it. They don't have to tell you exactly what's going on. I mean, it would be nice if they could. Most kids can't.
Right.
But if they could tell you how they feel, and then if you have done, a comprehensive blood panel, let's say, or you have their stool analyzed, etc., and now okay, I have a child. Like I know with my kids, I have one child who has GI issues, and
Right.
she has actually she has celiac. So she must be on a gluten-free diet, right?
Yeah.
So it's important to find that out and do the best you can with it, and because the better they feel, the more they learn.
Yeah, absolutely. Their thing got chopped off. So she went on to say, we struggle with is that our daughters can't tell us how they are physically feeling. Are there any procedures to teach kids to tell us if something hurts? My little one is almost 6 and not using many words. So starting with that.
Yeah, because you
Continue.
can't teach them to tell you when something physically hurts, but you can teach a child to identify, to match the way they feel that day to a picture.
Okay.
Okay? So it's not about, my tummy is causing me pain today. It's more about, today I feel like that.
Right.
And then another day, today I feel like that. And if you do that over the course of time, every day, and you can teach that because you can see when your child is grumpy, teach them to touch
Yes.
the one that is unhappy.
Yeah.
And you don't have to have 6. You can have just 2.
Right.
Or 3, a
Yeah.
neutral one, a positive one, and a negative one. And when they're happy, teach them to touch the happy. And what you're doing is you're just matching. And it's a simple concept, and the child will get it. And from there on, at least they can communicate with you if they feel the upset one or the happy one, or if they're just neutral.
Absolutely. There we go. Reza has written in, I'm going to get back to the medically enhanced in a minute, but Reza has written in and said, my 10-year-old autistic grandson bites and eats the pencils anytime he has a pencil. Any advice?
Yeah, so, okay, so there's a thing called pica, which is actually ingesting non-edible items, right? So eating them, swallowing
Right.
them, eating them. It is very dangerous. With pencils, you're looking at wood and lead. And so you need to make sure that this is not happening. So there's always 2 things. One is, what's causing this? Let me see if I can treat that. And in the meantime, I can't let my child keep doing this because it's dangerous. Okay, so you have to block it behaviorally, and you can do that a number of different ways. Like you could just, there's stuff that you can buy for kids who bite their nails, and it's kind of like tastes sour. It's pretty neutral, but it doesn't taste very good. You can put that on the pencil. Child won't, or just avoid giving pencils, like make sure they don't have access. Block that behavior. You cannot allow that to keep going because it can get very, very dangerous, right? You got to be very careful with that. I know a child who just came out of the hospital who had ingested a whole bunch of tiny little Legos.
Yes.
I mean, it can be very, very dangerous. So please block that however you can, make it an aversive experience for the child. You have to do that. The second part, though, is finding out, what does it correlate to, or what's causing it? Is there a deficiency? A lot of times with pica, kids have some sort of deficiency, and you can find that out easily through a blood test. So not that blood tests are easy for our kids, but you can find out. So that's one thing. Have a conversation with your pediatrician about that. The second thing is does it have to do with the kind of chewable texture of the pencil? I don't know if you guys have ever actually chewed a pencil. It's very fulfilling.
It is.
Because
there is
it's there's
like
a little crunch, and it's soft enough.
It's spongy.
It's spongy, and it's crunchy at the same time. It's very interesting. So you need to figure that out. Is that what's going on? We're trying to identify the why, the function, as you would in behavioral terms. If you think that's the case, because it only ever happens with wood pencils and it really doesn't with anything else, you do need to teach the child to replace that. They can't keep doing that. So you can actually give them, there's lots and lots of non-dangerous chewy toys that are there for kids, where if they really need to have pressure on their jaw, that would be an ideal replacement. You literally purchase those. You purchase them online. Now, all of that said, let's also find out why the child has this need for their jaw to have pressure. And I have found that with a lot of kids, if you can do regular massage of the jaw, it actually does help. Yeah. And another idea is to, depending on the age of the child, 10. If you could I don't know if you have access to behaviorists or not, but oddly, chewing gum is a decent replacement for some of these behaviors. If there is a team of behavioral people who can actually help teach your child to chew gum without swallowing it, that is something that might help as well. You're replacing it. You're trying to replace it with something that's less harmful.
Okay. We got a lot of questions coming in, and I had one that I needed to get to that somebody had written in last night. So let me get to that one. My 5.5-year-old son, who did attend full-time ABA for 2.5 years, then went down to part-time ABA for months, and now goes into typically developing preschool without any support, loves to start and keep conversations going with just telling random facts about things. Currently, he loves to talk about frogs. I would love to hear on how to get him to stop and teach him how to have meaningful conversations, or at least keep conversations going by asking people questions. I knew he still needed ABA, but I felt pushed by the BCBA to let him go into preschool. He does well academically, he participates appropriately, and he doesn't have any behaviors. However, socially he has issues. I would like to work on this so he can learn how to make friends when he is in kindergarten next year. We call that monologuing. Is that what you guys call it? When they go into the whole thing about the facts and they start to, they're monologuing now. It's a thing that in the Incredibles, that they talk about when the villain starts to do his thing, and they're like, oh, he's monologuing now, where they start to tell their thing.
Interesting.
But I know you know how to address this.
Sure. And I also kind of know why our kids do it. So I think that's an interesting, that's what experience has shown me. So the child is trying to converse, okay, and they have or communicate and interact. A lot of our people don't realize that a lot of our kids do not want to be isolated. They actually want to interact.
Yes,
they just find it hard. It's not a skill that comes to them naturally. So part of interaction and interacting with our society and our community has to do with a back and forth exchange. It has to do with inferring and predicting the other individual's thoughts. This is really, really important. Like if I start to tell you about something and you're in front of me and I'm observing your reactions and you go like, then I'll know that this is going down the right path for you, and I will keep going on that topic. If I look at you and you've lost interest clearly, and I've read it, I've been able to figure out from your facial expression or from you walking away or from whatever body or visual sign you give me that you have lost interest, I will probably stop. And I'll be like, oh, in my mind, I'll be like, oh, this person has lost interest. I better figure out what to do. Maybe I should change the subject. Maybe I'm talking about something they don't like. Maybe all these things I will infer. And the reason I'll change the subject. Why do I do that? Because it matters to me what you think of me. That's the most important part of it. It matters to me how you perceive me.
Right.
Okay, so our kids don't have any of that. A lot of times they're not aware of the stuff you're thinking or others are thinking about them when this is occurring. They have a very hard time actually seeing things from your perspective. This is called the theory of mind deficit. They see things primarily from their own perspective. And while they really care, they just don't realize that I'm not making friends because other people find this behavior to be weird or boring, the subject, whatever. They don't realize all that stuff. So you make them aware. And the way that you do that, you can do it many different ways. But I think that it's important for the child. We have actually a whole series of lessons that focus on teaching perspective taking. First of all, you want to make sure your child can actually take perspectives. That's really, really important. There's lots of different ways to do that, and you can, I think we can give them still the skills information because you can access that, and there you go. And if you go on there, you can get some ideas about how to, in fact, these days, honestly, just go online and say, how do I teach a child with autism to take other people's perspective? You'll get a bunch of ideas.
For those of you who are listening, though, in podcast, the website we just put up was skillsforautism.com.
Skillsforautism.com. And you have to go on, you have to learn how to do those exercises to give the individual the ability to take someone else's perspective. That's really important. And then I think once they have that capability or ability to really think through what other people are thinking, then it might be helpful to actually videotape an interaction that the individual has with others, and then to sit down and analyze the videotape with them and say, look, you're only talking about one thing. Look at this other person's body language. Do you think they're interested in this? Probably not. Look, they're walking away. And by the way, if you don't have something that obvious, just make it happen.
Yeah.
Like have a friend or someone come and have your child talk about the item that they want to talk about, and have the person like walk away bored, or have a facial expression or something like that. And teach your child to read cues in the other person that tells them, oh, it's time to stop and talk about something else.
Yeah.
Now, remember, you also need to make sure your child can talk about other stuff, right? So like they have, because our kids tend to want, like when they love something, they obsess on it and they learn everything there is to learn about it. Teach them other stuff, teach them other things, so they have a variety of things to talk about. And this is all going to seem very kind of like weird and fake to you when you're teaching it. But that's okay. That's how we learn. And eventually it's not going to be fake anymore. Like eventually your child will actually get the idea, be really, really good at picking up these cues in the environment and being able to talk about other things based on other people's reactions.
What's funny is that I remember it as a very fun time when we were teaching this to
Great,
them.
great.
I really do. Because in the beginning, if you follow, because we were following the Skills for Autism pathway, in the beginning, they taught him sensory perspective taking before they taught the whole thinking.
Right.
And it was super fun. I remember the day that we were sitting there and we had a barrier.
Yes.
And there was one thing happening on one side and one thing happening on the other side. And I was sitting on one side, he was sitting on the other side. And the behavior technician was on the side with Jem and talking it through and saying, what can you see?
Yeah.
I see a red truck. And then, can mom see the red truck? In the beginning, he said, yeah, mom can see the red truck. And he was like, really? Let's go check.
Yeah.
And then they would run to the other side of the table and go, look, sit where mama's sitting. Can she see the truck? No.
Yeah.
And it was like a magic trick to him.
Yeah.
And then and then he was like, well, now run back the other way. And why can't mom see the truck? Can mom see the truck? And he was like, no.
Yeah.
She can't see the truck because that thing is in the way.
Yeah.
And he got it. Then
Yeah.
we went on to smell. Like, you know, can mom smell this? Because she's over there. You can smell it, but it's right here, but she can't smell it. You know, it was, can mom hear that? Mom, you know, and so he got it that
Yeah.
depending on where you are, you might not.
Exactly.
And then he quickly applied that to everything.
Yeah.
And it was a very exciting time.
Yeah.
Where he started asking questions about other things. It lit up a part of his brain
Yeah.
that was there. It was totally there and accessible, but that he wasn't accessing.
Right.
And he got excited about it. But I also remember when he would monologue at us, and that there was a period of time that we said, okay, you love that. So you're going to tell me 2 things about that, and then you're going to ask me something.
Right.
You can't go on to the 3rd thing.
Right.
And we just had that rule.
Yes.
We just had a rule, and then the rule went away.
Yeah.
We don't do the rule anymore, but he learned, oh, okay, I can't just endlessly
That's right.
verbally vomit on you.
And see, that's such an important thing you just said, Shannon. Like, there, in the beginning for our kids, sometimes you just have to set a rule.
Yep.
And then later, you kind of have to explain to them, by the way, the reason I'm not letting you monologue is because other people don't want to interact with you.
Yeah.
If you do that. You know what I mean? Like,
Yeah.
and sometimes in the beginning, when the child isn't really able to go all that into abstract thinking, it's just a rule.
Yeah.
Because, you know, I want what's best for you. It's kind of like if any other child that goes to school, you tell them, listen, don't pick your nose in front
Right.
of other kids because they're going to mock you, right?
Yeah.
And the child might, oh, okay.
Right.
Like certain things are just rules.
Yeah.
Yeah.
I'm going to say something, and then he's going to be mad that I shared this, but I you know, he's out of this phase now, but the phase that we just went through was that sometimes he would just explain things to me as if I didn't know them,
Oh.
which comes across as mansplaining, thank you.
Yeah.
And we had to have a talk about that.
Yeah.
I was like, you are assuming
Oh my
that I don't
gosh.
already know that.
Yeah.
So what can you do differently? And he was like, oh, well, maybe I need to ask you.
Yeah.
Maybe I need to say, hey, do you know about whatever before I go into it and explain it to you? And I was
Yeah.
like, yes, because it presumes that I'm an idiot.
Yes, yes. It's so funny.
And then, and I was like, people aren't going to like that, Jen. Anyway, here we go. We got a lot of questions to get to. Okay. Excuse me. Park says it may be out of today's topic. Nothing's out of today's topic. But my 8-year-old son, who is in special school, he always watches nursery rhymes, phonics, or ABC songs till now. Last year, he watched a Peppa Pig social story, so I was happy. But he regressed back to watching only songs. How can I teach him to watch social stories, YouTube, such as Sonic, normal 8-year-old watch? I aim to go to cinema during this summer to watch a children's movie, even 30 minutes to sit quietly and watch that. By the way, we're saying hi to Rosie and to Rodney. And Dee, I'm going to get to your question next.
So I think there's basically 2 different sides to this. The first is if you just want your child to watch a movie, then you reward that.
Yeah.
And you can reward it gradually, Park. So for instance, you would maybe require, 10 minutes of something and reward it heavily with something else. So like 10 minutes, you're going to watch a social story or some other thing, but then you can go back to watching something musical, right? And then it's now 15 minutes and 30 minutes and et cetera, et cetera. Mm-hmm. And you can shape any behavior by rewarding it. That's just a given. The other side of this, though, is that he's interested in musical stuff.
Yeah.
So it's kind of like, let's also promote that because that's an awesome thing. He's interested in musical stuff. Have you thought about actually teaching him some musical instrument that could change his life?
Yeah, absolutely.
So I feel like you need to also, sometimes we get so stuck in, I want my kid to do things like other kids.
Yeah.
That we don't actually realize the cool things they do that other kids don't do.
Right.
For example, a lot of our kids are incredibly talented musicians,
Yes.
beyond what a typical child would ever be able to do.
Exactly.
Or incredibly talented artists. So, keep an open mind about what he's into as well. I think
Yeah.
that's very important. And then the other side is also obviously whatever he's into, make sure that you are also limiting it so it's not taking over his life.
I just have one word, Disney.
Yeah.
I mean, look
Yeah.
at all the Disney musical
Yeah.
movies that are appropriate for everything from age 2 to 102.
Yeah. Yeah. Absolutely.
If you can watch something like that at home before you go to the cinema this summer,
Yeah.
I have a feeling he might really like that. Now, Dee wants to know, is it common in the U.S. that a shadow teacher with to have a shadow teacher with a high-functioning autistic student in secondary or high school? They're writing to us from Turkey. They want to know, in mainstreaming, is that a common thing?
I don't know if I would say it's common, but it is one of the steps of how we mainstream kids. It really, I think, depends on where you go, because some school districts do allow that, and other school districts you kind of have to fight for that. It is, so it happens, and it is definitely the right thing. And it's, what is, here we have this process, you probably know, which is an IEP, which is an individualized education plan. So when a child goes to school, they have this individualized plan that allows us to put things into it that are accommodations. They're modified. And then gradually the child gets used to things in school, and then they might not even need an IEP. But it is a common thing in an IEP to actually have a shadow or an aide in the classroom helping the child. And you would have to have an IEP, and you would have to make sure that this gets in there.
Yeah. I think it's much more common in grade school. I think that junior highs and high schools fight harder
yes,
and
very
say,
true,
no,
very
we think
true.
it's more appropriate to,
Yeah.
their go-to is to say, we're creating a special program.
Yes.
And the program is that most of the day there's a group of, and it's mostly, boys with one girl in the classroom that stay with one teacher, and
Yeah.
and we have a special curriculum for them, and da-da-da-da-da-da.
Yeah.
And for some kiddos, that's exactly right. For a lot
Yeah.
of our kiddos, that's not right. And you have to fight. You have to fight for the aid, and you have to justify it. The law is on your side, but
Yeah.
it's a pain in the, to fight it.
Yeah.
It's
And that's, I
possible.
think, important. The law is on your side, but again, it's not easy.
But let me also say the disclaimer that I've been giving is that the law is on your side today. We do not know what is going to happen. We've heard that there
That's true.
Today is February 18th, 2025. We have heard that any minute now the Department of Education might be changing. We don't know. But right now, that is the law of the land. There is IDEA, and I can't speak to the future, but right now your child has a right to whatever support they need to be successful in the least restrictive environment, which, could be mainstream.
That's right.
That is
That's
the
right.
law of the land. And
Yeah.
so we fight and we advocate and whatever. But most schools that are junior highs and high schools will tell you all kind of, oh, it stigmatizes the child, what, but, because they don't want to pay for it. It's expensive.
Yeah.
That's my opinion. I have to say
No,
that.
no,
That's my
it's true.
opinion.
It's exactly
But they don't.
what we've
That's
seen,
why they don't
right?
want to pay for it. Okay, back to medically enhanced questions because we've
Okay.
had more of them. Okay, we were with an ABA company who was very specific about not wanting us, not working with us if our son on our son's other issues like diet and allergies. Are all ABA companies like that?
God, I hope not. I hope not, but there
Well, we know
are-
they're not all because CARD
Yes.
is not.
No, right. But it's more, yeah. I think a lot of ABA companies don't have any kind of policy around this, but I do think that a lot of BCBAs are trained this way.
Yeah.
That's the problem. And I think it's almost BCBAs, board certified behavior analysts, it's almost like they feel like they have to be protective of ABA, and they think the way to be protective is to poo-poo on other stuff. Now, what is fascinating to me is that, forget about the field of autism as a whole, just look at the general population, and the number of people in the general population who themselves now have a gastrointestinal issue. Okay. That to me is what's key, right? Because over the years, that has just increased. There used to, I always, for those of us who are older, we know that there was a day when you never saw on TV a commercial either about a probiotic, a prebiotic foods, pharmaceutical medications that are just focused on irritable bowel with constipation, with diarrhea, you name it. I mean, GI disorders across the country have increased exponentially over the last couple of decades. And that's a whole nother discussion that, you know, we could get into about how wonderful our food and soil is. But all of that it exists. So whenever I'm giving lectures to our BCBAs, I can't ask them because, you know, it wouldn't be legal for me to say, how many of you guys have GI issues? But I tell them, like, think about this, guys. Think about yourselves. And think about the fact that imagine if you had some mental issue, like let's say you had anxiety, and the psychologist who's working with you would say, I'm not going to treat you if you're also taking a probiotic. Just think about that.
Yeah.
So it is a very, very horrible thing that people in the behavioral field think that they have the right to take away from a child, from a family, any kind of intervention that the family feels is appropriate. I do want to say that the other side of this, Shannon, is that over the years there's been a lot of people who try to make money off of autism.
Oh, yeah.
So there's been a lot of that, and I think there's, you know, I'm always worried when the next thing comes along and people are like, oh my God, I wonder if that's a cure. And listen, we all fall into that trap when we have something going on and there's no like clear path.
Yeah.
We're always like, I should try this, I should try that. Because there was a period of time where there was a group of people who had a cruise. It was like they had rented a ship or something, and they would do a cruise, and they would market it as the recovery cruise. Bring your child on this cruise, and your child will recover. Do you remember that?
No.
There was a time when blood transfusions were thought to be the cure. There was a time when swimming with dolphins was supposed to improve autism. There was a time when lots and lots of people would mortgage their homes in order to have $20,000, $40,000 so they could pay for 20 dives of a hyperbaric chamber for autism. I mean, there have been a lot of things out there.
Yeah.
So I can understand that people are also, you know, scientists, behaviorists who want to say, I'm a scientist. They want to have proof. They want to have interventions that have some sort of result. But what people don't understand, Shannon, is that it's not always about immediately reducing the symptoms of autism. Sometimes it's just about making the individual feel better so that they can learn.
Right.
And you know what I mean?
Absolutely. Recently I was talking with a BCBA about this, and they were saying, here's my thing. I don't know about diet. I'd like to know more, but I don't have that to share.
Yeah.
But I'm not standing in the way of my family's doing it.
Right.
I respect
right,
that.
Right.
That to me seems, you know, they said you know, have a licensure that says I only talk about what I know about.
Absolutely.
So I'm not going to talk about
diet.
Yes. But that doesn't, I'm not poo-pooing it for the family.
That's
I respect
exactly
that.
right. That's exactly right.
I respect that. What kinds of interventions besides ABA do you recommend, and can we do those in addition to ABA? Obviously, you can. That's what we've been talking about.
Oh my God, there's so many different things. We have this whole other show that we've done where we talk about kind of all the different steps that you can take, and a lot of those
missing. Go Google that in the Ask Dr. Doreen. Right, what's missing?
What's missing? Yeah, because there are all these other things you should be looking at. First thing is, to me, is very important is just all the physical health things.
Yeah.
So I'm not going to go through treatments because there's hundreds of treatments, but there are areas of treatment that you need to also consider. So, for example, GI issues, like we talked about, all the medical things, right? So any kind of gastrointestinal issue, which could be leading to constipation, diarrhea, bloating, all that. Then there's obviously any kind of cognitive mental issues. So a lot of our kids have anxiety that is not dealt with. Some of the kids start to become depressed in their adolescence, which is not dealt with. How come we deal with it in ourselves? We don't deal with it in our kids. Like, oh, well, he has autism, so yes, he also has anxiety. Deal with the anxiety. It's not a symptom. It is correlated, obviously, because when you have all the things that go on with autism, for example, sensory issues, right? Sensory dysregulation. Yes, you're going to have heightened anxiety. But that doesn't mean you cannot treat the anxiety. Treat the anxiety. Make the person feel better. How about sleep? Sleep to me is one of the most important things, maybe because I struggle with sleep, but sleep is such an important thing for everything. So treat sleep issues. Don't ignore these things. These things are vital to the well-being of the child. Sleep, anxiety, depression, any of the physical issues, seizures, anything physical. Deal with all of that, right? And then with behavioral intervention, with ABA, what you're really trying to do with ABA is just teach. And what you're teaching are a series of behaviors that are going to help the individual thrive in life. It's kind of like tutoring. I just keep referring to it as tutoring. It has its own techniques and it's extremely effective, but it has to do with teaching things that are going to help the individual, whether they are teaching the individual how to behave, how to use less challenging behaviors, like more adaptive behaviors to communicate, or just teaching the individual skills, like social skills and language skills and cognitive skills and executive functioning, all these skills that everyone needs to do well in life. So it's about teaching. And everyone would agree that you learn better when you feel better.
Yeah.
Just take care of all these other things. And I don't want to by any means miss dietary, because dietary is one of those big interventions that works very well with GI issues.
Absolutely. My child rocks constantly, and it is hard for him to learn or focus because of it. What do you suggest?
Yeah, rocking isn't its own thing. Honestly, there's a really big part of me that I hesitate to block rocking, because rocking is a very calming
Right.
behavior. We've talked about this before. It's funny. We classify rocking under the self-stimulatory behaviors. And I have often said I'm not sure that it's self-stimulatory. It's more self-relaxing or self-soothing. And that is because when you rock, when you do this motion, it activates the parasympathetic part of your autonomic nervous system, which is calming, right? It's similar to when you sit on a rocking chair.
Yeah.
That is the motion. You notice rocking chairs don't go side to side. They go back and forth. So that is the same thing. A lot of our kids rock when they're actually trying to concentrate, or when they're really trying to self-soothe, or it has become a habit. Now, when it interferes with other stuff, then you kind of have to stop it, have the individual focus and attend, and then they can have moments of time to restart that. There's, it's because it's self-soothing, it is a reinforcer.
Yeah.
So it's identified as a reinforcer. You want to be able to give access to reinforcers as much as possible to any individual. So that means wherever it is appropriate, you give them access. What do I mean by appropriate? If it's preventing the individual from learning, as in this case, you want to make sure that you can stop it. You literally just help them sit and learn, and then you allow it as a reinforcer. So you gradually shape that. It's always a shaping process when you allow someone to do something or not, right? You do it gradually. You also want to make sure that it's not a social stigma, because sometimes kids will look down on someone else who's constantly rocking, and they don't want to interact with that person. So that's the other side of it, where
That
it's,
ticks me off.
I know, but that's just how it is. That's just how it
It
is.
ticks me off, though.
Yeah.
Why is that a thing, and we don't make fun of the girl who constantly is
Yeah.
cutting her hair?
Yeah.
Why is that okay?
Yeah, yeah. So these are things that people have to get used to, right? And the world around us doesn't support that necessarily. But all I want this parent to remember is that it is self-soothing, and therefore, by definition, it's a reinforcer. So if you're going to block it, make sure you give access at certain times, because you're taking away a very reinforcing, self-soothing thing.
Yeah.
But it's perfectly fine to block it because you want the individual to learn. But don't block it all the time, just the times where they're not learning.
I want to throw one more log on it, that sometimes, though, our kids are rocking because of a gastrointestinal issue.
That's also true, and that has been published, actually, even where they will rock and also put something that protrudes like a countertop or something in their belly and rock over it. And it's funny, if you have yourself severe GI issues, you will do that.
Yeah.
Like, that is a very relieving type of experience. Yeah. Yeah.
So kind of important to know.
Think
a little
outside
bit
the
more
box.
Why?
Yes.
Why that it is happening. Last question that I have here, and we're almost out of time. Excuse me. What are your thoughts on risperidone, and would you advocate using it while your child is having ABA?
Oh, that's a completely. It doesn't matter if they're having ABA or not. Risperdal, is an antipsychotic medication, and there's a few of these now, and some kids cannot function without it.
Yeah.
Other kids totally don't need it, and in fact, it makes them very lethargic and unable to learn. So it is really something that you need to work on with a neurologist, and you need to observe over time if it's a good thing for your child, or if it's if the dosage is right. But it's a very personal thing, and it's something you got to work on with your neurologist. I've had kids both sides of I've had kids where I've met them and they just were completely zoned out. And over the course of a long time, we took the child off Risperdal and then realized he cannot function without it, and had to come back and actually reintroduce it, but with a much lower dose. So it's about dosing, and it's about need. And the spectrum of autism is all over the place, and some kids really absolutely need access to an antipsychotic.
Okay. Important to know. All right, we're really out of time, but I want to thank everybody for being here. I want to thank you.
Oh, thank you.
My goodness. What you add to the conversation is just immeasurable.
Oh, thank you, Shannon. You're so kind.
No, you are. Want to remind everybody, we have a live show tomorrow. We're welcoming Maria Perrin is going to be with us from PPL. We're going to be talking about the model of having individually driven medical, which includes ABA, the self-determination. And here in California, that is one way, but in other parts of the country, you're dealing with it. And this is a company that helps drive decisions that you make for your child, to be the fiscally responsible
Very nice.
organization that helps to make it possible so that you're not managing everything under the sun. So we're excited to welcome them. We've got some great shows coming up as we get close to April. Absolutely amazing. I hope that everybody, I had to be very quiet about it. Are you watching the show The Pit?
No, not yet. But
Oh,
I've
my
seen
goodness.
the trailer. Yeah.
Okay, well, so we're watching The Pit. It's a great show. It's on Max. We weren't allowed to say anything, but Kobe has,
Oh.
you can see him in the waiting room before he actually gets in, because it's that kind of a show. But he has a whole segment. His thing just aired. Kobe Bird.
Oh, great.
He's been a regular here on the show. We're going to
Awesome.
welcome Kobe to talk about what it was like, because it's a show that's shot in a very particular way with just Steadicam. They do turnarounds with the camera.
Wow.
So they're acting in 360 all the time on the set.
Wow.
What that was like, and there's a very much a great story about celebrating neurodiversity on that. But
Interesting.
so watch Kobe. He did a great job playing
Awesome.
somebody very different from himself,
Interesting.
but a young man on the spectrum. I think
Ooh,
you'll
I
love
can't
it.
wait
So
to see.
check it out, you guys, and we'll be back tomorrow with more show. Until then, give your kiddos a hug from me and one for you too. Bye bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.